Surveying the wreckage. So what I'm trying to do here, I've split the essay into 3 parts. So the first part, surveying the wreckage, which looks at the COVID era really, and just sees how big a blunder have we made. And then the second part would be then, well, what are the root causes? What took us there? And then the third part is, how do we fix it, essentially? So it's 3 parts. So surveying the wreckage, what I'm doing really is just giving us some bottom lines of the mess we're in. I mean, we've squandered hundreds of billions away on measures, which were pseudoscientific. I'm talking about lockdowns, tracking and tracing, highly contagious respiratory virus. There's no evidence that that's going to do anything useful. And we've spent an absolute fortune on this stuff. And we've transferred trillions of dollars from the poorest to the most wealthiest in the process.
There's been a massive wealth transfer, hasn't there?
Massive wealth transfer. And that's just part of it. But
the poor are getting poorer and the mega rich are getting richer.
Yeah. And this burden's going to be around our necks for many years to come. And we were seeing at the moment with this, the politicians arguing about the fuel money for the pensioners. I mean, this is a drop in the ocean to what they were spending.
It's peanuts.
Absolute peanuts. They were just burning money like you wouldn't know what. And it's borrowed money too. So we've got this burden around our children's necks, basically. They're going to be paying for all that. But it's not just a financial burden, educational burden as well. And then on top of that, we had a complete abandonment of medical ethics where young, healthy people were coerced to take products, these so-called vaccines, which are quite frankly are not, I mean, they've been purported to be safe and effective, but I don't see how that any products can be labeled this way, especially that one, because we've seen reanalysis of randomized controlled data by Joseph Freeman. Joseph Freeman.
He's been on the channel a couple of times.
I mean, he's an amazing doctor in Louisiana. And the fact that we're relying on doctors from the swamp to actually do the job that the authorities are meant to be doing. But he's looked at the randomized controlled data, 1 in 800 risk of serious injury from taking these mRNA products. And when you then scale that up to the amount of doses that have been given.
The global rollout. I mean, you talk about tangible harms.
Tangible, I mean, so that is a tangible harm. You've basically injured millions of people in that process. Most of them at very, very little risk from this respiratory virus. If you were young and healthy, the risk was negligible. The risk of flu would be higher, actually, or at least comparable in a young, healthy person. So there's no reason whatsoever to coerce people to take these products. And of course, the argument at the time would have been, oh, well, it's just to prevent the spread, to protect the elderly. Well, it would be unethical to do that anyway, but we know that it doesn't
work either.
It doesn't stop transmission either. So
it's unethical and it didn't work.
Exactly. And I mean, just to sort of, as a quote I put in the essay, where I spoke to a doctor who'd just seen a patient who had a severe reaction from one of these vaccines. It was the AstraZeneca, and the patient had one of these clots. And died, actually. And the doctor said to me, well, it's the price we have to pay to keep everybody safe.
That is...
I mean...
What a way... it distresses me that doctors would be thinking like that.
Well, and that sort of sums up the era, doesn't it? How can you keep everybody safe if some people are going to be injured by the thing? So the whole point of medicine is that it's a risk benefit, basically.
And at the level of the individual, it's not utilitarian.
Well,
or exactly.
It shouldn't be. It shouldn't be. But even if it was, even if you were just looking at a population level, then it still wouldn't work anyway. It's not stopping transmission. And there's no reason to think that it would stop transmission when you understand how these products work. I mean, the fact that we didn't do proper randomized controlled trials, and the trials were then torpedoed, I think is the term Dr. Malhotra has used, which I think is a pretty accurate description of what happened. When you give the control group the actual product.
Yeah.
So we don't know. We'll never know really.
Eradicating the possibility of longer term follow-up.
Yeah, we will never know 100% the damage that these products have caused.
Yeah.
Because observational data is all we can rely on now, and observational data has got a lot of confounding variables, so we're never going to get to the bottom of that. Indeed. But anyway, I've just surveying the wreckage. So that section of the essay really is really showing how far we have strayed, and it sort of justifies the next part of the essay is, how on earth did we get there?
Yeah. Let's just unpack it a little bit further, because we've got plenty of time today. You've got the inverted belief paradigm.
Yes.
I think that's what you've just talked about, isn't it?
Yeah. So
everything's upside down.
Yeah, everything's upside down. So in the essay, what I talk about is tangible harms and then untangible harms.
Yeah.
So the tangible harms would be the money that we've wasted, the educational losses, and the actual injuries.
Yeah.
Then the untangible harms is what I'm talking about there is the psychological effect that this has had on the population, essentially. Because, I mean, what we've done really is it's like almost like a psychosis, but it's
a mass.
The people have used the term madness
of crowds.
Yeah, madness of crowds, that kind of thing. Yeah. I don't actually like the term psychosis because it's
got a very specific medical meaning.
It's got a very specific medical meaning. But I suppose when you have a belief, when you've got a society that's strayed from reality to this sort of belief system of very narrow thinking of things like safe and effective. It's like a
the false dichotomy you were talking about.
Yeah, it's like a hypnosis almost. Yeah. You know, of trying to reduce complex problems into these little sound bites. Nobody is safe until everybody is safe. Nobody is safe until everyone is safe.
What does that even mean?
What does it even? It's impossible, isn't it? It's totally impossible. So these are the intangible harms, which you can't actually physically see, but they're still there under the surface. And we need to understand what's happened there, because you've got, I think a lot of people are in denial now of what happened. And I think it would be very dangerous to sweep all this under the rug and say, oh, it was a bit of a panic. We might learn a few things. No, we have to go through this with a tough comb and work out exactly what went wrong, because the next time some perceived crisis comes along, we will need to have learnt from the lesson, hopefully.
You know, in a sense, maybe psychosis isn't such a bad term, because my simple definition of psychosis is a detachment from reality. A psychotic is not in the real world, he's living in his own world. So maybe it's not such a bad term after all. And then you've got the underappreciated mechanisms of long-term harm.
Yeah, exactly. Underappreciated long-term harm. So the way that these products work, I mean, I think a lot of doctors would, if a patient came in with a problem into the hospital, they'd had maybe one of these experimental products, even a week later, they're probably discounting it as too much time has passed. A month.
The cause and effect link has gone from the medical brain.
Yeah, it's gone from the medical brain. They just wouldn't think that a product like a vaccine could cause a product a week later, let alone a month later or 6 months later. How would that be? And a lot of the reason for that is that there's a misappreciation of how these products work. And if you cause inflammation in the body or cell damage, you might not see the downstream consequences for some time. And I'll give you an example of that. I'm just going to this is hypothetical. I don't want to scare people who've taken these products, okay? Because we're still talking numbers where on an individual basis, the risk is probably low. I mean, Joseph Freeman's paper was showing serious harm in 1 in 800 people. But when it's when you look at it on a population level, you realise that this is a really big problem because we've got millions of people affected. So I don't want to scare people who have taken the products. I just want to make that absolutely clear. But you have this product. It's got a lipid nanoparticle in it. I'm talking about the mRNA jabs now. And then your body is going to produce foreign protein in cells that can't necessarily regenerate. So, for example, the heart And so you might have some silent myocarditis when you take the product. We know that there's a troponin rise in a certain number of patients. It's quite high.
Quite a big percentage.
Yeah, I think it's 1 in 30, I think.
I think it's around about that numbers. Yeah,
1 in 30. I mean, to think that there's a significant troponin rise in 1 in 30 patients.
And we should say that troponins are a marker that's measured in the blood that indicates damage to the myocardial cells.
Yes, exactly. So if you've got damage to the myocardial cells, that's not good news, because the heart doesn't repair itself very easily, and the brain doesn't repair itself very easily either. So, I mean, if you took one of these products and let's just say hypothetically, someone took this product and it killed a certain number of their brain cells, however many thousand brain cells, you wouldn't know straight away. It wouldn't be until much later in their life that maybe they just get their dementia a few months earlier or something like that. This is hypothetical, but what I'm trying to say is that
we simply don't know.
We simply don't know, and we don't. The only way we can tell in medicine is to have long-term studies.
Yeah.
And this really brings us to the heart of the matter. Yeah. Is that people were told that it's safe and effective in the absence of long-term studies. Well, you can't know that because you haven't got a randomized controlled trial, which has got the length that you need. You need the main ingredient, which is time, to be able to tell if something is safe.
And there's plenty of precedence for this in medicine, isn't there? So you could be exposed to a toxin, for example, that destroys some of the cells in the substantia nigra that make the dopamine, maybe half of them. Yeah. Then you get Parkinson's disease at 50 instead of at 80 or something. So,
exactly.
There's a lot of, and this is the mistake I made personally, I think, in my thinking at the early stages of this. I couldn't conceptualize that for want of a better term, vaccine could cause long-term damage. I was always thinking about the immediate effects, and now that this has become apparent and obvious, I can't quite work out why I didn't realise that, but many of us didn't. And
I mean, there's multiple mechanisms. I mean, one of the mechanisms that Dr. Malhotra, esteemed cardiologist, has pointed out is that you might get inflammation of the coronary arteries, and then and so that maybe you have your heart attack earlier than you would have had it, because you've had that build-up of plaque. Earlier. Now, you're not going to detect that. You're not going to detect it in a clinical trial either, and it's not a short-term clinical trial. And there's so many mechanisms of harm for this drug because it goes everywhere. So it can go to any organ. It could affect the immune system.
It does. We know it goes everywhere. It goes to your toes. It goes to your ears. Every organ in the body. There's systemic distribution of these minuscule lipid nanoparticles. Yeah. And we were told they weren't, but they do. We know they're systemically distributed.
And what's incredible as well is that, I mean, for the mRNA products, is that there was a randomized clinical control trial, but it was shut down early. Just by the way, when it was starting to show significant harm, suddenly it gets stopped. You can make of that what you want. And the argument, the argument that was made was, it's unethical not to give the control group this because this deadly virus is going to kill. Well, actually,
viewers will have their own view on that.
Yeah, the viewers can have their own view on that.